I had been diagnosed 8 years ago while out of town with congestive heart failure. And at that time, all that was prescribed for me was medication and to change my diet, less salt, less fat, no alcohol. You know, anything that was fun, I cut out of the diet. I also had a defibrillator implanted into my chest about a year after that. Some months ago, just prior to Christmas, I had noticed the symptoms returning of congestive heart failure, and I knew something was up. I did go to my cardiologist for an appointment, and she examined me and immediately put me into the hospital. This time the symptoms were so severe that it was explained to me that I would have to have, eventually, I would have to have a heart transplant. But until a heart would become available, the procedure for me would be known as an LVAD procedure. An LVAD is a small pump that was surgically implanted into my chest and neck, attached to my heart, that would help my heart pump more efficiently. That my heart was not efficiently pumping out. It's what's called a low ejection fraction. With my heart not operating efficiently, eventually that caused the problems of all of my organs not operating efficiently. So when I went in to deal with the congestion that was in my chest, first of all, that had to get drained, but then we had to, the doctors explained to me of what would have to be done to help my heart work efficiently, and that would be to have a small pump. It's about this, it's the size of, I don't know, a walnut. And it goes, it was, of course, they cut me open and implanted this small pump to my heart, to the valves, that would help the pumping process. And then it has to be powered. So there is a cable that runs from the inside of my body to, there's a portion of my abdomen where the cable comes out. And that cable is connected to this controller, which is also connected to batteries, which I have to charge and change every day. Kind of like if you've ever used a cordless drill or a cordless screwdriver, it's pretty much the same process, only instead of that, it's my heart. Before we started the rehabilitation part of it, we had a one-on-one meeting with Michelle, who's the head of the Cardiac Rehabilitation. I did a questionnaire to just sort of see where I was at, both mentally and physically. And the mental is very important. You know, if I'm depressed, if I'm not feeling it, you know, I'm not going to be coming regularly. I'm not going to be doing the things I need to do to take care of myself. But I think I've been doing a decent job of that. So anyway, and Michelle agreed, and so we went over what the program would be. And I've been coming here 3 times a week, Monday, Wednesday, and Friday, and I love it. It's nice to see other people every once in a while, and to come into here with other people, both Michelle and Jennifer, the nurse, who are both fantastic. It's a physical activity, which is wonderful, and just some very, very sweet people to have met.